Hi everyone, I'm Wendy van Steenkiste. I'm president of the Belgian Patient Organization and focused on the Dutch-speaking part of Belgium. And I'm a patient myself. I received my diagnosis in 2009. Today we will talk about the Pulmonary Hypertension Patient Information Project. This is a project we started last year together with the Patient Expert Center, here represented by my co-speaker Jan Verstraeten and HTAP Belgique, the French-speaking patient organization in Belgium, with his president Luc Matthijssen. But first, we would like to thank the Alliance for Pulmonary Hypertension for their invitation to talk about this project. So first, I will talk about the design of the project, and then Jan will talk more about the hurdles we encountered in the first phase of the project and the results of the first phase. And then I will give an insight into the next steps in the following phases of the project. The Pulmonary Hypertension Patient Information Project, PH-PIP in short, wants to offer a systematic way to develop and maintain patient educational materials about pulmonary hypertension, and this as a collaboration between all stakeholders, so healthcare providers, industry, patient organizations, and patients. Why? Because in practice, we see that many initiatives related to the pre-competitive patient education on pulmonary hypertension are being launched by different stakeholders. However, these efforts often lack coordination and collaboration, which results in fragmented and inconsistent materials. And moreover, we saw that many of these initiatives appear briefly and then disappear, often before they even fully reach the patients. So this highlighted the need for a more unified, structured, and sustainable way of making new materials. We also observed significant differences in the type and the quality of education of patients. These disparities depend on the treatment center, the timing, diagnosis, and whether the patients had access to connect with the patient organization. So this inconsistency reinforces the need of a national coordinated approach, ensuring that all patients, regardless of location or circumstances, have access to the same reliable and comprehensive information. PH-PIP is guided by the Patient Expert Center, which plays a key role in shaping and supporting the initiative. In fact, the Patient Expert Center is at the origin of this idea and continues to provide strategic and organizational guidance throughout the process. Why PH-PIP? Well, when we look at the benefits of this initiative, we see clear that a clear added value for all stakeholders involved. So for the patient, it means that gaining more knowledge about their condition, experiencing fewer uncertainties, having access to a central source of reliable information, this empowers the patients and helps them to feel more supported throughout their care journey. For healthcare professionals, it results in fewer practical questions and more focused, meaningful inquiries for patients, and this allows for more efficient consultations and improved care outcomes, ultimately leading to higher satisfaction with the care provided. And additionally, it eliminates the need for duplicate efforts, such as proofreading educational materials. For the industry, it ensures that products are used in the best possible way by well-informed patients. It also presents a valuable opportunity for collaboration with all partners in the healthcare ecosystem, enabling shared efforts and mutual support. For hospitals, it removes the need to create their own materials on general topics, saving time and resources. And for us as a patient organization, it offers a chance to demonstrate our professional role we want to play and showcase our expertise in supporting patients. So as you see, we all have needs. The patient needs information, the healthcare professional needs materials to illustrate their message, and the industry wants their product to be used in the best possible way. We all have knowledge. The patient knows best what it is to live with the disease. The doctors know best how the disease can be treated from a medical point of view, and industry has a lot of knowledge to make, for example, materials as attractive as possible. And we all have resources. The patient organizations and the doctors have access to patients. Industry has the financial resources. And with this project, we want to bring this all together to achieve the best and most efficient result to create these educational materials. We are convinced that it's a unique pilot project that is not only addresses the specific needs of patients with pulmonary hypertension in Belgium, but we hope it can also serve as a model for other countries or therapeutic areas. By taking a centralized view of patient needs, the project enables a clear identification of existing gaps in the indication and support of patients. And one of the key strengths of the PH-PIP project is the cost effectiveness, because by developing pre-competitive educational materials collaboratively, stakeholders can share costs while avoiding duplication. The materials are managed in-house, meaning that there are no royalties to pay, which was for us a very important topic. And the Patient Expert Center provides also a sort of a quality label made with patient experts. Looking ahead, we want to create this project and this design to be future-proof. The project is centrally managed by patient organizations, and it will be also made flexible, allowing for easy updates and adaptations. And while coordination is centralized managed, there will be room for local accent and customization, for example, practical details by hospital. So finally, we want to try PH-PIP scalable with a structured approach that will make it possible to export this to, for example, other countries or therapeutic areas if there is interest to. The project is based on expertise and methodology of the Patient Expert Center, and based on their methodology, we will do the next steps. First three we already did in phase 1. That was identify the information needs at each stage of the patient journey, but Jan will tell more about that. Gather all available resources and define the logical order in which the materials should be developed. Later on, we will create the content, distribute and implement the materials, and evaluate and refine the materials continuously based on the feedback from patients and professionals to keep them up to date and impactful. This process ensures that patient education is not only well-informed and inclusive, but also dynamic and responsive to real-world needs. Okay, so now I stop my part and I will give it to Jan.
So thanks, Wendy, for explaining the design of the project, and I'll try to guide you all through the reality and the hurdles we encountered during the execution of the project. So one of the hurdles, let's say, or the reality checks we had was that it's quite a bit of work, quite a bit more work than we expected, or at least some parts of the project. So first of all, it was a completely new concept, so we need quite some time to explain it to everyone, to all the stakeholders, to come back on that. And then also we needed to convince them to collaborate with their people's knowledge, mainly on the healthcare professionals, but also to get some financial support because we spent quite some time and hours, and that costs a bit of money. It's secondly, it's linked to the nature of hospitals. Actually, it's hard to plan and to find people together to plan meetings together with several hospitals and several people. So we tried to meet first of all everyone together, but that didn't work. So we had to meet every hospital team separately, which actually was quite some more work. But in the end, we got better result because we have one-to-one discussions and the people are more engaged in the project. Everyone knows what it is about, and everybody has had his input. So probably, let's hope, the end result will be used more. Then a third point are the patient pathways, where we estimated that we would have enough detail with a draft patient pathway, but the project taught us that we need a quite detailed pathway. So it was quite a lot of work indeed. That's the patient journey part. You see, it's about 20% of the time went to there. It's a lot of work, mainly on layouting. You have to make it readable to keep it usable. And then the planning, that's what I already said. It's a lot of time went into planning and scheduling meetings with this big group of people, which is on the next slide. We had a lot of collaborators, a lot of stakeholders. So the two university hospitals which are specialized in, or which have professors that are specialized in pulmonary hypertension in Belgium, then a lot of smaller regional hospitals. Also the pharmaceutical companies developing products for pulmonary hypertension in Belgium, or selling products in Belgium. And we got supported by the Prince Philip Fund as well. So we got all these people around the table, which is great for the collaboration, but again, it required some effort to plan meetings with everyone. Voilà. So as explained, we had a bit more work, and you can see we made a planning. We tried to plan this as good as possible. To be honest, it was the very first time we executed as Patient Expert Center. We executed this kind of project, so it was hard to foresee and to plan how much time every step would take. And there you see clearly that the patient pathway and the pitches to the healthcare professionals took extra time. We did them simultaneously, so it was pitching and explaining the concept to the healthcare professionals while collecting their feedback on the patient pathway we were making. So luckily we could do this simultaneously, but anyhow, it required quite some time. This is similarly, it's here, it's more the budget instead of the hours on the previous slides. But here, so we got budget from sponsors, for which we are very grateful. But probably in the future, we will need some new way of structurally supporting this, since it is not an one-time project. The idea is to have a new system. It's a way of working, and so that actually the patient organization handles all the information for the patients. Let's say all the pre-competitive information, so everything that it's not specific to a treatment or to a hospital. So we will need to think about more structural support. If anyone here has ideas, please let us know. The cost effectiveness is indeed an element, but we still need to prove this cost effectiveness. That's actually also why we think about medical affairs or business units of pulmonary hypertension can maybe shift some budgets internally, that not everything has to come from the patient engagement budget, because otherwise it jeopardizes the normal structural budget for the patient organizations. There was a small issue with VAT that's quite technical, but it means the Patient Expert Center has VAT, so it's then we don't pay them, and then other patient organizations they don't. They are not obliged to charge VAT, but then they pay VAT. That's a detail, but it made quite a difference. So honestly, luckily, sorry, we had some results, some good results. So as explained, we drafted a patient pathway. We needed it to be able to identify on the patient pathway which information is needed for the patient. It was more work than foreseen, much more work, but the result is actually quite invaluable. we had several iterations, and we ended up 1, 2, 3. You see on the slide, we ended up with a metro mapping based style. Metro mapping is a Dutch methodology, or developed in the Netherlands by a PhD student, but actually she already died of, I don't exactly know the list. The idea is that it's a very useful way of visualizing a patient pathway. And we did not completely use the metro mapping, I mean, because yeah, we considered it too late, and we had already spent quite some work in making it in this shape. And also we don't have the Visio software on which it's based. Metro mapping in itself is open source. You can just download the tool, but you need the Visio tool of Microsoft to use it. And we will share this with everyone. Everybody that want to have it can have it. We have it in PDF or in a Draw.io file. It's made in Draw.io. It's a very good working document where you can clearly see all the steps and all the phases in the full disease, from early signs to end of treatment. And then on the lines below, you see the context and the contacts of a patient, also the information needs, and then we indicated in the two bottom rows, we indicated the existing information, and so the difference of both is the information that need to be created. Our idea is for the next phases is to review this and have this redesigned in a bit more user-friendly way. But this is a very good working document. It's way too complex to use on a day-to-day basis, but to manage stuff or to see what a small change in treatment could mean in a pathway of a patient, that's actually a great tool. The second deliverable, the second result of this project was that we have collected a lot of information. We have collected about a little 100 documents, 80 and some on SharePoint and some physical documents as well. And we organized them. And if anybody has more information on pulmonary hypertension, we can gladly share the link to dump your information. I think we have information in Dutch and French and in English. And the third deliverable of the project is actually the priorities. So we changed slightly with our original idea, where originally we thought we will create a big starting kit, or whatever you call it, like a book or a leaflet or a briefcase or something that a patient can receive at the point of diagnosis. But during the workshops we had of the project and with all the stakeholders, we decided on the priorities, and the first priority that came out of this meeting is actually a base document that is given in the pre-diagnosis phase. So actually during the medical tests, and the document explains all forms of pulmonary hypertension, and also explains the tests to get to the correct diagnosis afterwards. So for example, an explanation of the right heart catheterization. And then the second priority is this patient roadmap, which is actually a simplified version of the full patient pathway we designed. And the idea is to publish it on the website, and that it's like the framework for all the next steps, and so that you can zoom in on, for example, on the website, that you can zoom in on a specific part of the roadmap, and then you get more details on that phase in the disease. And then the start kit is only priority 3 now, and then we go further down but then we are talking in 1 or 2 years. So what did this total project so far cost? We got funding for about 22,000 euros for the first 3 steps, and we spent a bit more, 27,000 euros we spent, and it was all on work. Actually, the most of the work is really on the cost, I mean, is on hours, is on man hours, as we say in Dutch, but it's effort spent by us, by the team. That had really little external costs so far.
So to end, I will give you some insights in the next steps for the coming phase. So looking again at the project design, the next steps are clearly identified. So we, as Jan also told, we will begin by creating the materials, following by their distribution and the use of the practical use of the materials. And after implementation, we will evaluate the impact, make adjustments where needed, and establish a feedback system to ensure continuous improvement. So based on our priority list, phase 2 will focus on the developing of a base document about pulmonary hypertension in general and the examinations that the patients undergo. And next to that, we will create a patient roadmap, as Jan said, a simplified and comprehensive version of the patient journey we already made in phase 1. So this can be a guideline for patients when they receive their diagnosis. And this will also be the frame of all further work in the future. So looking ahead, future steps will include the development of a comprehensive support kit and the psychosocial educational materials. So if we look a little bit more in detail for this base document, this will explain the diagnostic examinations that are typically performed when PH is suspected, along with the possible outcomes of these tests. So this is a document that will be given at the patients at the moment when there is a suspicion of pulmonary hypertension. So the doctor can explain what to expect, well, which examination that will be performed, and which are the possible outcomes. So for that, it will cover all forms of pulmonary hypertension, including the more common non-rare types, because at this point, when PH is suspected, you don't know yet what to expect. The content will be based on the image of the 22 clinical guidelines, and will take inspiration for the great example already created by the Dutch colleagues of Stichting PH Nederland. And to allow for personalization, the information will be organized in separate files or subjects, because we want to allow to make it tailored to the specific needs of the patient. So not every patient needs the same examinations. So you can literally take those information or educational materials that you need for that patient. You will also pay special attention to the differences in health literacy, making sure that the materials are suitable for various audiences, whether these are children, adults, or individuals with varying levels of medical understanding. It should be for everybody, this information. So the patient roadmap, the simplified version of the patient pathway, will be specifically designed to be patient-oriented and really easy to understand. And you have two parts. You have until diagnosis, that's the moment that we will give also the base document. And then after diagnosis, so this document will be given at point of diagnosis so that the patient will have an understanding of what comes next. At this moment, we see sometimes as patient, when you have your diagnosis, that you don't know what to expect, what are the possibilities, when can you expect a prognosis, how your treatment will evaluate. And so this is what we want to give here to the patients, that they know, okay, we were going to go in this direction. Then we have consultation 1, consultation 2, and then at that moment we for example, stable, and we have the integration into the daily life. So then we have the information that is needed when you want to go working or have hobbies. Then again, you have the disease progression. At that moment, you need other information. And at the end, you have the end of life care. So this will be like a guideline of what can be happen and in which direction you will evaluate. This section will focus on the rare forms of PH in the first phases, such as PAH, CTEPH, and the pediatric PAH. And to ensure the accessibility and the flexibility, we will offer 2 versions of the roadmap. So one, a digital interactive version of it on a website, it's a central managed website, but also analog paper-based version that can be handed out during consultations. And we hope that this roadmap will be a valuable tool to support patients throughout their journey, helping to feel them informed, prepared, and empowered. So here you have some examples of a possible outcome. We don't know yet, but we collected some nice examples. And that brings us to the end of the presentation. So we hope this overview has given you a clear understanding of the goals, the structure, and the potential impact of our project and what we want to do. Thank you very much for listening. And now we'd love to hear from you. So if you have any questions, I myself, I'm not there at this moment, but Jan will be there and Luc is there, so they can, if you have questions, you can ask to them. Thank you very much.